on average. Therefore, it is very possible that poverty in terms of income is going up between 2008 and 2010. There's almost no doubt about it. However, we do have the information of what happened to various social rights or access to social rights between 2008 and 2009. And we are measuring this only within poor municipalities we call zonas de atención prioritaria, poor municipalities in Mexico. And what happens is the deprivation for health went down dramatically from 51 to 39% due to the new program which is called Seguro Popular, which is directly linked to the method. So if you measure that dimension, it is very probably that that dimension was going down, educational gap was going down, access to food was up. However, housing access to basic food was down, and the deprivation for quality of living spaces was down. Therefore, the Mexican state wants to show that all these dimensions went up, and these are related to poverty. Sorry. So we have there. Sorry. One moment, please. Yeah. So this is a good example that what happened to poverty income in Mexico? Well, it went up. Why? Well, we don't know why, basically. I mean, perhaps it were international problems, and we got in Mexico the increase in the cost of food, and therefore we wanted to differentiate both. Finally, an important feature of the methodology is that it does not only identify poverty, as I said, which must be a priority, but also identifies the whole population without access to social rights, which we think is a complete way of looking at public policy. Thank you very much. If I have time, I may go to social cohesion and to cutoffs. Thank you much. I have time. Do I have time? Or no, well, I don't want to. We can go to questions.
Do it briefly, and we'll try to catch up on
All right. Thank you. Oh, we can go. Sorry. I was running away.
Since you came from Mexico, and don't worry, talk about Congress. We're just taping you.
Let's talk about briefly. I'm going to talk about the idea of the cutoffs. So how we determine cutoffs. So our method was as follows. We said, well, if we are following the Mexican regulations and Mexican constitution and all that, let's go first to the legal criteria. If the Mexican laws talk specifically about a cutoff, let's use it. A very good example is education. We may discuss here what will be the cutoff for educational level. Should it be literacy? Many people say, well, that's the bottom line. Let's use literacy as a cutoff. It makes sense. And other people say, well, no, let's go to university, because for this century, going to university is very important. So let's put a cutoff there, or something in between. So instead of that, we say, well, let's see what the Constitution says. And the law said that the minimum cutoff, the cutoff is basic education, which is primary and secondary level for Mexico City. Therefore, the cutoff was those who are not getting to secondary level are deprived. If they were children, they should be in school right now. If they were adults, they should comply with they should check if they have basic education. If we didn't have legal criteria, we went to experts, but experts basically in the field of public institutions. For instance, we went to this institution for housing, which is within the executive, so they can tell us better what they have thought about the cutoffs in housing. So that's the way we did it, assuming, again, that these methods should be used by the Mexican state, therefore we want to involve public institutions with the cutoffs. Not only us, we are very intelligent academia people. We wanted to go for government and for Congress. So for instance, the educational gap I already said. It's secondary education. I don't know what is it. Secondary education. Around 15 years old, 14, something like that. So children below 15 should be going to school. Otherwise they are deprived. Or people older, they should have basically they should have primary before 1981 when the law was changed, and after that they have to be secondary because the law changed. So access to health, there is a law, a health law, saying that the minimum access to health is the Seguro Popular, popular insurance. So that's the minimum one. Some people may thought, well, the Seguro Popular is really low. It's better to have the formal social security, which delivers higher benefits. Well, the law says the minimum one is social Seguro Popular. We may not be happy with that cutoff, but that's what Congress said, and they represent Mexican people. That's our assumption, of course, huh? Irrespective of what we think about individual Congress people.
Very highly.
And therefore, we did this to Social Security. We did something similar, perhaps more with more variables or with more decisions in terms of direct access. In this case, some members of some family members may benefit if the parent has Social Security. It goes also to them. And also we are highlighting the senior citizens. The package we think, or the law thinks is important, is jubilación, how to say? Retirement. So we looked at the senior citizens. If they didn't have a retirement pension, then they were deprived. So, and the quality of living spaces. This institution, the public institution, told us that roofs with certain materials, walls, floors, and overcrowding. And in this dimension, they are deprived of this dimension if they have at least one problem in any of these dimensions, because we think that social rights must be completed, not only just half of them in this sense. So housing is the way. Water, sewage, electricity is the same way. In terms of access to food, interestingly, we got this idea from FAO. How to say it in English? Food FAO. FAO, yeah. FAO Schwartz. So they've got a scale of food insecurity. Is it? So we adopted that scale, and we put it for Mexico for 12 questions about how the family perceive their hunger experience. Is it because of economic problems that you didn't have enough food, you or your children? So we constructed this scale, and that's how we measure access to food. Is part of the dimension. So if is moderate or severe deprived, this is what we got, and perhaps this is the only dimension in which we decided ourselves the cutoffs among the people. I mean, asking to the experts outside, we determine that ourselves. And in terms of income, we have, for the minimum economic well-being, the extreme poverty line, we have food basket, and for the higher one, we have food basket plus non-food basket in terms of what a certain mobile decile needed reported to have. So we measured that value, and we put them together, and we have both the food basket and non-food basket there, and that's a higher one. and we subtracted goods and services that have income elasticity of more than one. So let me go to the next ones. Social cohesion, finally. Difficult one, but we thought about the following. We may have this type of society in this chart, but we may have this other type of society. This is a more dispersed and separate population. These are more together. Therefore, the way of solving the problem, perhaps we are not solving that for good. We are still working on that. Is using indicators from dispersion. For instance, inequality or polarization, and we also have another one for networks, isn't it, Ricardo? So the way we thought about it is, well, let's go for dispersion with another advantage, that we talk about poverty and also about inequality within the same framework. So that's also very appealing for some people in the social areas. And therefore, for instance, we have the Gini index by the state. We have the darker ones with more inequality. South here, north here, Chihuahua. If you once visited Chihuahua, you may see a modern city like Chihuahua, and a very poor municipalities like Tarahumara. So there's a huge contrast there, and inequality here, and huge inequality within Mexico City, as you can imagine as well. So we are measuring this type of dispersion indicators for the country and for the states and for the municipalities. And finally, if you allow me, we did produce guidelines and criteria for identifying poverty. And this is useful for programs to identify their population, their beneficiaries. And the law says this is a mandatory application for public institutions. Social programs should consider the indicators of multidimensional poverty. That's the law. The guidelines should be incorporated in social programs and evaluation. However, the way in which we wrote with the executive the guidelines are quite flexible, meaning that programs are not obliged to use all dimensions to select their beneficiaries, because, for instance, Oportunidades doesn't go for housing, for instance. Therefore, they don't have to apply the housing problem. They only have to get the beneficiaries which are within poverty, but of the dimensions they are aiming to solve. So we do have that part of the legislation, which is important. We are implementing it. We have 2 years to implement those. Of course, we sometimes have problems of the programs asking, well, how can we change the way we identify for the new one you want to put? We are helping them, and we are learning on the way, I have to be honest. So that was the fact, and thank you very much.
Thank you very much, Gonzalo. So I'm going to propose that we try to be as efficient as possible with the questions in an interest of saving some time. So we'll try to limit the rounds to about 2 rounds of questions. So we'll try to limit it somewhat, and we can return if there's any really pressing questions that people have. We can return to that in the subsequent follow-up session. But so I see Rinku, and I see Joao Pedro, Tara, and Ruslan for the first round. Rinku.
Thanks so much for the presentation. It was incredibly interesting. I have a question on your data systems. I mean, it sounds like you're going to be doing this every 2 years. At least the Constitution says that you should. And if you're actually categorizing all the individuals, it means you're going to be running a census every 2 years. That's what I'm interested to hear how that's going to happen. Yeah.
Thank you, Gonzalo, for the great and very stimulating presentation. I think you mentioned some very interesting and concrete aspects of both on the conceptualization of this in a concrete term, on the measurement. and the use of it. But it also raises a number of issues for me, thinking in how to apply this in the context of maybe other countries, right? So some of the